Well, at the outset, thank you very much, Malcon Organizing Committee, and in particularly, thank you very much, Dr. Amita and Anil Suchak, to be here at this point. I feel greatly honored to have been asked to give this oration, which stands on the name of a person who was an icon in this city, having set up a very landmark medical services in this part of the city and going much beyond medicine to help many social causes. And I wondered over years how, without a great modern science backing him, how much did he serve the community? And today, with the advances, are we able to match what he did? And if we can't, then there's something going wrong somewhere. And I thought, therefore, that I would choose the title of my oration as Quo Vadis, which is a Latin term which says, where are we going? And I thought this is a need for introspection. What the forefathers could do, I thought we could be doing much more and much better. And has it translated into the better health of the nation, better health of the people whom we cater for? And I'm sure the answer is not very clear. And one thing is certain, that we haven't done much better than what they did. And we haven't done much better in spite of all the modern amenities that we have. On one hand, we boast so much of more knowledge, but on the other hand, it doesn't seem to translate into reality when there is so much of poor, so much of illness, so much of malnutrition, so much of chronic diseases, and so much of preventive diseases, which still are many, many in this country. And I thought this is the time to introspect. And when I saw your theme of interesting cases, I thought, what interesting cases can I talk to all of you? I thought I would just introspect what happened over my last 45 years of pediatric practice and see where we stand today on that. Let me take you what has been the past and the present as I view. When in last century, before modern medicine developed, and that's what I think the time Dr.N.V Suchak practiced, the physician could offer personal attention with compassion and concern for the patient. That gave a lot of comfort, if not cure. Their philosophy was care definitely, cure if possible. I don't think today we have much done very differently. But what we have been doing is, we are after cure, which is not always there, but in place of a care that should have been always there. And how is the present largely? I think we are lucky to see this century where the entire thrust on healthcare is an area of modernization with automation, advanced medical technology, computerization. At the fingertip, you can see everything, what's happening in the world. If that is so, then there is no doubt, in spite of that, there is an indisputable depersonalization of patient care. What I mean is that earlier, the generation of Dr. Suchak treated the family. They just did not treat the disease. Today, we treat the tests. Then we started treating the numbers, not even the tests. My cholesterol has gone up by 1 milligram. I need to take anti-cholesterol medication. So we started treating numbers and not the patient. And I think that's where the modern science has gone somewhere astray. And I thought with great advances, we are missing the link that a legacy has been provided to all of us. And somewhere down the line, I thought a combination of traditional wisdom and the modern science put together would probably do something wonderful. The West is realizing what Indian culture stood, and now they're going back to yoga and so on. And here are we, with all that legacy, trying to go after the Western medicine and to see what the modern technology can do. I thought, therefore, there is some reason to really look at. Well, super specialization has been a boon, no doubt, but it has been a bane as well. We need to use very judiciously the super specialization. Today's family physicians are all-rounder, like Dr.N.V Suchak was. And I think they bear largely the brunt of making decisions whether the super specialist is necessary or not. Today people run for a super specialization, and every super specialized person would have a narrow vision, though in depth. And a family physician has a wider vision to choose exactly what the patient needs. A super specialist treats what he thinks is wrong with the patient. A family physician treats what is really wrong with the patient. And I think this difference has to be maintained. And we need to have this kind of a generalist who understand which patient needs a super specialist and which does not. Today, I'm sure in this city, with so many super specialized people available, an average patient must know whether it is heart or a liver or a kidney that is damaged. And if he did not know that, and if he had just the fever, or if he's just losing weight, whom will he go to? I recall a time when a good physician saw a patient for just fever, cold, and cough, and he realized that there is something amiss, and there is something going wrong. He didn't know. He thought that he had some mild puffiness, so he should see a nephrologist. The nephrologist had to rule out a kidney disease by every test known to science, because today is an evidence-based medicine. You can't say you're all right. You may not be all right. You must test to be sure you're all right. A nephrologist said you're all fine, but I think that your veins in the neck are a little prominent, so you must see a cardiologist. He goes to a cardiologist. Cardiologist does all kinds of tests and confirms that the heart is normal, but he finds that the eyes were a little prominent. So he said, maybe a hyperthyroidism, and you must see an endocrinologist. So he had a mild puffiness, he had the veins going large, and he had a prominent eyes. Endocrinologist ruled out with every hormone. And the patient goes back to a family physician and says, what kind of rare disease I have? No specialist can make out. So he said, look, we don't know now. He said, what about my remaining life? He said, you're not sure. So he said, the patient said, let me now enjoy all my wealth, and I don't know how long I'm going to live. So he goes to plan a world tour and goes to a shop to buy new clothes. And he tells the shopkeeper, show me a branded shirt. He says, sir, what's your collar size? He said, 14. No, sir, it's 16. If you're wearing 14 with a tie, you will have a puffy eyes, the prominent veins, and a prominent eyes. He said, oh, that's my problem. Now, you needed somebody like that to know what the problem is, because none of our books said that a tight collar would do all that. I recall when I showed a cow to an intern, and I asked him, what's this animal? He said, of course, cow. I said, are you sure? He said, yes. Do you want to do a test? He said, no. He was just an ordinary graduate, and he thought, what cow looks like, why do you test? It's a cow. I asked an MD. He said, looks a cow, but it's much better you confirm with some tests. He had learned much more. When I showed a DM who was highly qualified, he said, there are many probabilities, because he was well learning. I said, what's the first possibility? He said, it could be an atrophied elephant. I said, how can it be? He showed me a literature and a case report in Lancet, which showed that, yes, it was an atrophied elephant, was missed for a cow. I said, what next? He said, hypertrophied goat. Again, a strong literature support. He gave many possibilities because he was well educated. Then I asked him, what is cow? He said, yes, that's the possibility. When I rule out all of them, I will consider it. The message is, what is simple and common in the community still is common. And you don't have to remember. Unfortunately, all of us, as we grow, remember rarer cases much often than the simple ones. And we make a mistake. I think we all need to be undergraduate and a good undergraduate. I thought the super specialist must be an excellent generalist. And he can't say, you are sneezing, go an ENT surgeon. No, that cannot happen. Having said that, what are the common pitfalls today? a lack of detailed history taking. There is a nice book written by an American author, and the title is How Doctors Think. He talks about the real stories in Boston just 10 years ago, and how doctors think, and the whole topic at the end of live stories comes out a message that doctors don't think. So, a detailed history. There was a girl in US who was dumped to be a psychiatric because she was losing a lot of weight and she could not eat. She was seen by every super specialist in Boston. She was fed up. She had lost 20 kilos. She was thin, and she thought that there was nobody who could say. She was dumped as somebody who has a functional disorder. One of her relatives said, there is a good family physician in Boston, the old man. Why don't you see him? She was really disgusted to meet the doctors. He took her forcibly to a general physician in Boston. Here was a 70-year-old, a general physician who sat in his office. This girl walks in. He says, what's wrong with your problem, madam? She says, you have all the reports on your table. You must have seen all that. She had seen every specialist. He said, I haven't looked at any reports. I want to know from you, what do you think is wrong with? She said, nobody has asked me this question. They had looked at my tests and decided my kidneys are all right or liver is all right. So she was most surprised that this man is wanting to know from me what is wrong with me. Nobody bothered that. She said, sir, it will take a long time. It's a long history. He said, madam, I have enough time. Go ahead. Second shot. He has enough time? People saw me in 2 minutes. How can he have enough time? She was further surprised. She said, sir, I can't remember many things because it is a long story. He said, doesn't matter. Whatever you remember, you tell me. He hears her for half an hour. He puts her on the couch. And he said, madam, let me check you now. He looks at her nails and looks at all nails. She said, nobody looked at my nails. What is he doing? She was curious. She asked him, sir, why are you looking at nails so much? He said, madam, you never know where is the clue to your disease. I must see you thoroughly. Oh, she got a surprise of this. At the end of that, he diagnoses a celiac disease, stops wheat product, she starts improving. The message this book gives is that today's physician does not even take a detailed history. And the history gives you a diagnosis almost at 85%. What are the excuses? We have many excuses. We have no time. No attempt to interpret. We have lack of thinking. Then unfocused physical examination. We don't know what we are looking at. Then vicious cycle. I call it a misapproach. What is a misapproach? Management first. Don't think. Start managing. Mostly it works. If not, investigate. And if investigation also don't show, then ask them, what are your symptoms and what are your signs? We are going the wrong way. And no doubt that we catch a thief first and then search our house, what is missing. Because there is a thief and you must be missing something. And I think that's the approach today. We are very highly dependent on laboratory tests. We don't document, we don't communicate. How can we communicate when we don't know? So every time I see a 2 days fever, I call it viral. He continues, I say malaria is common, you never know. If he continues for 8 days, I say typhoid, very common in our country. If he continues for 2 weeks, TB is of course to rule out. And parents must wonder how doctors think. They don't know, we don't think. So the question, introspection. Are you a rational prescriber? And I think, is specific therapy possible? Every time you see a child or a patient, can I give him a specific therapy and cure him? Well, for which you need a provisional diagnosis. And then if no provisional diagnosis, what do? Is it safe to observe without empirical therapy? And I think that's the time we must think. Many diseases can wait to evolve a correct diagnosis only if you can wait. When the dark clouds come, you don't open an umbrella. There could be a bright sunshine. You just observe. You see what's evolving. Medicine is similar. If it's not safe to wait, of course, do some tests and start some empirical treatment. The question is, do you keep on changing empirical therapy? Well, that's not right. Mostly you need to change the diagnosis. So don't say that this medicine doesn't work. No, you are not working. You need to change the diagnosis. Do you decide on symptomatic therapy? I wonder when I see a prescription, paracetamol 3 times a day. Who decides paracetamol 3 times a day? It has to be only if you have fever. But the best part is, paracetamol is not given for fever. Paracetamol is given if you are uncomfortable because of fever. If I am comfortable with fever, why do you need paracetamol? That's why the cough syrups don't work, because no cough syrup takes care of cough, but it makes you comfortable for a while. The cough doesn't go away. But we give for everything. Every patient tells me, sir, I gave paracetamol, the fever increased. Yes, because you gave paracetamol when there was no need, and the body had decided to throw up high fever anyway. So symptomatic therapy is not the symptom as perceived by parents or somebody else. Symptomatic therapy is for the child to perceive. When a 2-month-old baby's mother phones me and says, sir, my child has a cold. I said, but what does the child have? She said, child has cold. I said, no, you think child has cold. Tell me what is wrong with your child. She doesn't understand. Then I have to ask, does the child sleep well? Of course. Is he feeding well? Of course. Is he happy? Of course. Madam, what is wrong with your child? Oh, he has a cold. Now, that's what the mother's perception is. You ask the child, and the child will say, doctor, don't listen to my mother. She's a little hyper. I hope you understand. So I think that's the way we go by. And I think how many drugs you prescribe is inversely proportional to your rationality. Do you test a test? I think you just ask for a test. Does your test confirm the diagnosis, at least support the diagnosis, or at least rule out a diagnosis? I'm sure today we use so many tests which are, to my mind, near useless. I make an emphasis near useless. At least in pediatrics, it's useless. What's platelet count? Platelet count in dengue fever only makes you hospitalize him till the platelets come up. They must be laughing at you. And then you are a CRP. CRP has replaced the ESR. Both are equally useless. It only tells you that there is something wrong with the fellow. That fellow also knows it well. Everybody does SGPT for every fever. I don't know why. Dengue, IgG, IgM. Dengue, IgG, IgM comes positive only after the dengue has got better or the dengue has killed the fellow. What are you looking at? NS1 antigen has come, and that only makes you afraid that it's a dengue. Just few years ago, we were very happy to call every fever influenza, which means that don't worry. Today, moment you say influenza, you said H1N1 or H3N2. Medicine has become complicated just by ourselves, and therefore, I suppose, so many things. Chest X-ray is never required if you are coughing badly. I'm sure a chest physician will agree to that. In pediatrics, airway disease makes you cough more, and the chest X-ray does not show you much of an airway, exception maybe an inhaled foreign body. Then the parents come and say, "Atli khasi cho to bhi X-ray normal che." Yes, X-ray doesn't show that airway, and therefore you wonder. And then the radiologist might pick up a small shadow, which is really a mucus plug causing a small atelectasis, and therefore a new term in radiology that has been prevalent for last so many decades is pneumonitis, not pneumonia. Pneumonia is inflammation of lung, and that inflammation is called pneumonitis, which means he tells the family physician, "You like to give an antibiotic? I support." So I think that's where we are going wrong. And CBC itself, I think what does a CBC do? Complete blood count gives an incomplete interpretation. It cannot just give you that. And just to show you that, look at a high WBC count in acute bacterial infection, in systemic inflammatory disorder, even early stage of viral infection, useless. And look at typhoid, no leukocytosis, leukopenia. How does the science know? And I think, therefore, to me, CBC is only reserved for a small purpose. But I'm sure CBC is the first thing that you do, and then you go by what the fellow says. If there are increased eosinophils, you give a diethyl carbamazine citrate, least important. And if there are high count, you say antibiotic justified. Who said that? Typhoid has no leukocytosis. So I think what we are missing really is something much different. Therefore, every test that you do, you need to answer, is this test work? Today, as a senior pediatrician, I get a phone call from my colleague and said, sir, 1 month of fever, I don't know what to do. Can you have a look at the patient? I said, what have you done so far? He said, I've done everything. Now, if you have done everything, leave me something at least. What is everything? Sir, I've tried 2-3 antibiotics. I said, what was your diagnosis? Sir, that's why I'm asking you. I have no diagnosis. Then why did you give all that? Then what do you want me to do? Shall I give an anti-TB drug? I said, no, wait, let me see what has happened. So the point is that we do a test because there is a test. We have not thought what the test is for and so on. If you are not a rational prescriber, you won't know what test to do. And you will have to test a test. Next is, do you communicate at all? Today I'm sure that if you communicate and even if you lose a patient, probably nobody will bother you because you have tried your best. We are not gods, but we need to show care. We need to show that we are caring. How do we show that we are caring? We need to communicate and we need to document. It's fine to say, I don't know, but I know how to know. You go to so-and-so fellows, they will know. Well, that's a guidance. Nobody minds if you did not know, but everybody would mind if you fool about saying you knew, you did not say anything, and today a lot of problems are coming only because we don't communicate. I think communication is the only key to successful outcome. It instills confidence. It sensitizes patients to be compliant. They said, my doctor is doing best for me. Not necessarily the best outcome, but a best care that is possible. When you communicate, it's a measure of sincerity, honesty, accountability. And I think that's where the earlier physicians were considered as God, next to God. Today, I don't think we are. Once I was traveling by air and the next person sitting by next, I was afraid to say I'm a doctor. Because the moment I say that, they say, nowadays doctors do anything. You know, so-and-so happened. You have to only hear those things. When I'm in a drama and an intermission, somebody says, hi doc, I'm a little worried. Because everybody will say, oh, you're a doctor, oh, same that fellow who keeps on fooling everybody. So I think today we have gone down to that kind of an image. And I think just because we have failed to communicate, it should be preferably worded. And I think it's our responsibility to communicate. When I communicate, parents are very, very grateful. I have not cured them. I may not have done something good to their satisfaction or demand, but I have shown them that I am concerned. I care. And I think that's the most important. So finally, friends, do you offer holistic care? Yesterday's generation offered holistic care. What we saw just now of what Dr.N.V Suchak did was a holistic care. He went beyond. And I think that's where he was respected by the entire society. I'm sure he did not cure everyone. I'm sure somebody died under his care. But even then, he had cared for everyone. And what is holistic care? It's not possible without using multiple human qualities. God has given so much qualities, and that is use of body, mind, heart, and soul. Unless a physician today uses all these 4 qualities, and what does it translate into medicine? Our body is knowledge. That's why we all gather, try to get more and more knowledge. That's the basis, but that's not enough. You need to have a mind. What is mind in medicine? A commitment. I will do my best. If I see a pharmacologist child, I am questioned about the side effect of every drug, not the effect. They are worried. Moment I say, give paracetamol for fever. Sir, liver toxicity. Okay. That means that pharmacologist is concerned about every step. Are we concerned about that when I write a paracetamol to my patient? So that's my commitment. What does it mean, my heart? A compassion. I need to be in the shoes of the parents whose child is sick. And then only I understand the pain and the discomfort and the anxiety. For you and me, sickness is every day. For somebody else, sickness is just one thing that bothers them the most. And you need to be very compassionate. And finally, whatever happens, you are really answerable to only one thing, and you are answering to your own conscience. That is the soul. At the end of the day, I must know that I did not do anything wrong. And if I did something wrong, I owe that mistake, and I would see that I will never do it again. Finally, I'll be answerable to my old soul. And I think the correct test of the whole thing is that if you lose a patient, the family should still come to you, because they know that you had done the best. What can happen? Yes, did happen. And suppose the family feels a little odd to come to you, they have lost somebody, at least the community should not lose you. And finally, if the community also unnecessarily blames you, but your conscience is clear that I did my best, and I'm sure if that is done, then only the holistic care turns into devotion. That's what Dr. Suchak was. They said, devoted, committed. And what is devotion? Just love and loyalty to my work. That's divine. Coming from some supernatural power, whatever you believe, call it sacred. And I think that helps healing. Healing is not because we give a medicine. Healing is something that comes from within. And the physician helps that something to come up. I'm sure that you must have seen as senior physicians that given a same situation, not all patients come out very well. But there has to be something beyond medicine. Medicines don't work, but something beyond. And I think the physician has that responsibility of seeing, and that's possible only when you believe that there is something beyond. Finally, we must answer to ourselves, are you happy and or successful in practice? After all, happiness is the final aim and not equivalent to success. One of my students told me some time ago, sir, you don't have an ambition. I said, what do you mean by that? He said, in your clinic, there should have been large number of patients waiting for you for hours. Oh, that's not my ambition. His ambition was, his teacher should be so much known that there are patients waiting for him. When large number of patients wait to see you, the patients see you, but you don't see the patient. You have no time to see the patient. Okay. One of my pediatricians said the other day, sir, I scored a century. I said, I did not know you play cricket. He said, no, I saw 100 patients today. As a pediatrician, you saw 100 patients. I quickly calculated in mathematics, and I knew that he had only 2 minutes per patient. And 2 minutes are enough to say, please come, please sit down, please pay and go. Isn't it? What can he do in 2 minutes? And he was very proud here, so I said, I don't score even a week's time. So I think that is where that. But friends, success lies in happiness. Today you want to be happy. What is success? Success is perceived by others. Somebody told me, sir, you are very successful. That is his perception. Happiness is my perception. Oh, they don't know I'm happy. And I think that is where we stand. What is success? Success is getting what you want. But what is happiness? Wanting what you get and getting what you need. I need now so little at my age. Why should I get more? If I get more, I am ruined, my health is ruined, my children are ruined. I don't want to do that. I need exactly that. And one of the authors has given so wonderful definition of success. And this is where he wrote Ascent to Soldis Ferrari. Robin Sharma wrote this, that success is an unintended side effect of an act that is designed to help anyone other than yourself. That's what Dr. Suchak did. He helped everyone, but he did not expect anything from anyone, and he still got something. Unintended side effect of an act that was designed to do something for good other than yourself. And I think you need to, therefore, as physicians, strike a balance between happiness and success. Everybody needs money, but you need more than anything as happiness. And you have to balance between happiness and success. And that only can help you balance between family and profession. I met one of my students who is a very busy practitioner out of Bombay, and I said, how are your children doing? He said, they are getting like this. I said, they're so fat, what are you doing? He said, no, sir, you did not understand. I see them only sleeping. That's why I said they're growing like this. I said, why do you do that? He says, sir, they go to school at 6:30 in the morning. I come home at 1 o'clock in the night, so I'm sleeping. Then they come in the afternoon, I'm in my clinic. I come late, they're sleeping. I don't see them wakeful. Oh, what a pity. He's caring for others, he's not caring for his own child. And I think, therefore, set your goal and follow it, whatever that goal is. Lastly, my perception of how to achieve happiness. I'm most happy today. I don't have much of practice, I bet you on that. There are several people who are very busy, but they may not be as happy as I am. And I'm not starving anyway. I'm well fed. So then, what is my way of acting? A balanced approach to 3 phases of life. Friends, we all have gone through 3 phases of life. The first phase of life was, I started practice, I had an aspiration to become a big pediatrician. And there was some compulsion also that I had to bring up my family, I had to bring up my children, I had to give them education. I required money. By the time I came into a middle phase, I started being greedy about money because that was an addiction. And I wanted more and more practice. I had no time for practice, but if one patient went somewhere else, I felt very bad. Even if he came to me, I had no time anyway. So I had a greed for practice and money. And then when you come at the last stage of your life, in a career, you feel I could have done something different. It's too late to change. And I think we all have gone through this. When you are young, you have a lot of time and you have a lot of energy, but you have no money. When you come to a middle age of a medical career, you have enough money, you have enough energy, you have no time. And when you become old like me, you have enough money, and you have enough time, and you have no energy. What a pity. Between 3 things that you need in life, you never had all 3, and you are lacking in one every time. What did you do in life? Why did you not balance that perfectly? And I think that is important. I've seen many people who work so hard. They create wealth by losing health. And when they become old, they spend all that wealth to regain health. Why did you lose health and then regain health and collected wealth and spent all the wealth doing that? Who asked you to do all that? You should have enjoyed life by working just enough and having a big leisure and happiness and all that. And I think that is where the whole thing lies. I know perfection is impossible. I know my limitations well, but I enjoy my work. And that is called EU stress. EU stress is an enjoyable stress. Today I work almost 14 hours a day, but I enjoy working. It's not a compulsion that I have to go to my clinic, I have to see so many patients, I have to run for an emergency. No, I enjoy my work. When I enjoy my work, it gives me happiness, and be sure it does not affect the coronaries. It's a stress, but it's an enjoyable stress. It does not affect my coronaries at all. What do you do then? You share work for peace and leisure. Today, last 35 years, I have a joint practice, and today we have 4 pediatricians working in the same clinic. Patients have a choice to go to anybody, and I work the least, and I enjoy the most. And my colleague is there, he also is happy that I'm not there so that he sees more patients. What is going wrong? Oh, it's good for everyone. And the patients are happy because they get more time, because we are 4 of us together. I remember when I started this, somebody asked me, but don't you think your patient will slowly go to your colleague? Sir, we are all one now. It's not me and him. And I think when you share work, you get a lot of time for leisure and peace as well. I thought yoga is really very good. It helps you to relax. It steadies your mind. It calms your emotion. And I think it tones your work. Well, ladies and gentlemen, I just gave you an overlook of what I thought. I'm sure there must be other views as well. But I certainly put my own views and how I looked at it and how I look at it today. And I'm sure that all of us can be more happy than more successful. Success is what others may think. Who cares for others? You must care for yourself. Thank you very much.